So now we're going to close the skin, and as I said, we will do that with an intradermal suture. And again, it's not dissimilar to what we've done already with the subcutaneous layer, in that the knots have to be buried in the deeper layers of the skin closure. I've chosen a monofilament material. There are a number of options with this. Because it's within the skin, it has to be an absorbable material. So monocryl is a good example. Some smaller gauges of PDS could be used for this as well. I've also chosen a cutting needle. It's a swaged on cutting needle, so it's nice and sharp. It should allow us to carry out the closure with a minimal amount of trauma. So I'm going to start at the caudal end. I'm going to place the stitch, or place the needle in the deeper layers of the skin, and I'm going to bring the needle out through the skin edge. So again, similar to the subcutaneous layer, we've got a stitch here, or a suture, which starts in the deep layer with this tail and comes out the skin edge. We're then going to pass through the skin edge on the other side of the incision and come out in the deeper layers again. So when I pull this through, what we have is we have a stitch that opposes the skin edges but has its tails in the deep layer. So when we tie a knot, and we'll do that now, an instrument tie, when we tie the knot is buried underneath the skin, but the stitch is opposing the skin edges. So now, because we're going to do a continuous suture, I'm going to trim off the tail, but not the main part of the suture material. And this knot is in the deeper layers, so now to begin the intradermal closure, what I'm going to have to do is bring the suture material up from the deeper layer where the knot lies and out at the skin edge. Now, when we place these stitches, we're going through skin edge to skin edge, and we're going to go straight across the wound, so it's quite a good idea just to have a look and see roughly where the stitch is going to pass across. And in this case, make a mental note, it's just in that area. So I'm going to cross straight over and just travel through the skin now, travelling along and parallel to the skin edge. And what we want to do is bring the point of the needle out through the skin edge. If you find that you come out through the skin, as I did there, just back off a little bit, readjust so that you're coming through in the right place. And as you can see, that just brings the skin edge across and into that position. And that's exactly what we're going to do as we move along the wound. So here we go again. Crossing the wound, we're just going to go in roughly here, parallel to the skin edge and out through the skin edge. You can see that that's beginning to bring the skin edge into that position. Same again. In at the skin edge, parallel to the skin, the wound edge, and out through the edge. Just crossing the wound, creating a position side to side. So I'm going to continue this suture line now right up to the end, and then I'll show you how to close off the end of the wound by burying the stitch.